Welcome back to This Week in Immigration. I'm Jordan LaPier. On the program this week, how immigrants factor into the healthcare system's response to the coronavirus, how a recession could impact immigrant workers, and exploring immigration, or the lack thereof, in the latest economic support bill. All that's just ahead. Stick around. Here with me today, as always, are Theresa Cardinal Brown, Director of Immigration and Cross-Border Policy. She's on Twitter at BPC_T Brown. Hi, Theresa.
Hi, Jordan.
And Cris Ramon, Senior Immigration Policy Analyst, on Twitter at CRamonBPC. Hi, Cris.
Hey, Jordan.
And we'll be joined a bit later by Laura Hall, Managing Director at BPC Action. So Theresa, Cris, thanks for being here. Let's jump in. As the U.S. government continues to manage the spread of the novel coronavirus, immigrants are emerging as an important part of the healthcare response to the pandemic. Not only are we talking about foreign graduates of U.S. medical schools, but also, say, DACA recipients working in a range of healthcare roles and foreign doctors working in the United States through military and exchange programs. So, Cris, I want to start by exploring who this group of people is and how they're involved in the fight against coronavirus. What categories of non-citizens are working in the healthcare system, and what kinds of roles are they working in?
So, writ large, what you're seeing is that non-citizens as a whole, the Migration Policy Institute put out a nice info brief on this issue, and when you see non-citizens as a whole of the share of all workers, there's 17% of healthcare and social services, which is pretty significant. But when you actually look within healthcare, you see that 29% of all physicians are foreign-born, 22% of nursing assistants are foreign-born, 29% of housekeepers and 24% of janitors and building cleaners in the healthcare industry are foreign-born, and 38% of home health aides are foreign-born. So the foreign-born make up a substantial part of the healthcare field. And then when you're looking more deeply into where these folks are coming from, well, obviously for doctors, some of them are foreign-born graduates of U.S. medical schools who came here, wrapped up their studies, did a residency, are now working in the United States. But then there's also, for instance, DACA recipients play a major role in the healthcare field. They're distributed throughout, particularly middle skill jobs, where they're also, they have the work authorization to be able to do that work. So they're able to contribute there. And I think it's also worth noting that the undocumented do play a role, especially in housekeepers, janitors, sometimes a little bit with home health aides and all that they're also a population that is actually active in this, even though they don't have status. So, there's a whole host of different individuals who are working through this that I think are very much active in the front line to the pandemic.
Theresa, what challenges does the healthcare industry face in integrating non-citizen healthcare professionals or non-citizens with foreign medical credentials?
So one of the key issues in integrating foreign-born into the U.S. medical system is credentialing and licensure. So for people who completed their medical education abroad, particularly for foreign medical graduates, doctors, the United States in most states requires to get U.S. licensure that you complete a U.S. residency. So even if you'd been a doctor for 20 years overseas, you'd have to kind of go back and do a U.S.-based clinical residency in order to get licensure in the United States, in addition to taking whatever licensure examinations may be required. And that's a pretty big hurdle for some immigrants. The other issues relate to language. Again, whether or not somebody has sufficient English language capability to work in a medical profession where you're required to communicate with patients, with other professionals on a regular basis, that can be a limitation. With regard to foreign nationals who complete their medical education in the United States, sometimes it relates to the visa status. So, for example, you can come to the United States to complete a foreign medical graduation, foreign medical study at a medical school on a student visa. A lot of internships or residencies are then on a J visa, which may require you to go home for a couple of years before you could come back and work in the United States. There are ways to waive that requirement for certain foreign medical graduates. One of the very popular ones is something called the Conrad 30 program, where states can sponsor foreign graduates of medical schools in the United States who have that J1 residency requirement on an H-1B visa to work in their state if they are underserved medically. And that's been very popular. And that's one reason why in a lot of rural areas in the United States, a lot more of the healthcare is provided by foreign-born physicians. So those are some of the challenges that can accrue. Obviously, if you're coming from a student, even if you completed your residency, getting sponsorship on an H-1B visa, those visas are limited unless you're being sponsored by an educational or a nonprofit organization, which some healthcare hospitals are, but others are not. And then getting permanent residence obviously also depends on what country you come from and how long you might have to wait. So there are some hurdles out there to foreign medical graduates joining the U.S. healthcare workforce. Another big impediment is for nurses. We do not have a temporary worker program for nurses who are in jobs that don't require a bachelor's of nursing, a BSN degree. And an awful lot of nursing positions and other middle skilled jobs don't necessarily require that bachelor's degree. And there's not really a temporary visa for those. Foreign nurses do have an ability to come on green cards, and many nurses do each year, but they are numerically limited. A high volume come from the Philippines each year, and there's a backlog waiting for nurses to come in there. So our immigration system itself is somewhat limiting to foreign medical graduates, although, as Cris said, non-citizens still tend to be very overrepresented in those healthcare professions at all levels.
So then, Cris, how have other countries addressed these challenges? Does the United States need to look at adapting here? And if so, what lessons could be learned and how to do it?
What's been interesting is seeing how other countries have sort of relied on two strategies. One is fast-track adjudication of immigration benefits to be able to work in a country, and the other one is recruiting of foreign-born professionals that are already in the country to work in this. So in terms of fast-track adjudications, for instance, you see, for instance, Spain currently is fast-tracking the credential review process for, I believe, a temporary permit status for foreign-born professionals to be able to work there. It's for 200, so this is a very limited scope program, but still for 200 foreign-born doctors. So they're trying to move through that process as quickly as possible to be able to get them to work there. A much more broader initiative is Portugal. So the Iberian Peninsula is doing something interesting. They are basically what they're doing is they fast-tracked and unilaterally approved all the residence permits, so that's the equivalent of the green card here in the United States, for everybody who was in that backlog for those applications, so more individuals can access healthcare as they can in Portuguese law, but also be able to work there. So those are two examples of fast-tracked strategies that you've been seeing. In terms of recruitment, well, this is where you've seen, basically countries like Germany that have been recruiting from the refugees that they admitted during the height of the refugee crisis in 2015, 2016. Many of them from Syria were in fact doctors in Syria. And so they have these credentials and they have some of this training. So they're just trying to find a way to incorporate these individuals into the workforce. You're seeing something a little bit similar in Buenos Aires, obviously in Argentina, where you're seeing some municipalities also hiring Venezuelan doctors who have arrived there, who have fled there from Venezuela to be able to work there. And even in the UK, post-Brexit, which is funny, is that they're also trying to find foreign-born professionals that they could hire for this. So, I think that the key lessons to take a step back is really thinking through, is there a way that you can fast-track certain adjudications for certain benefits for certain classes of non-citizens to be able to work in the United States? That's one question, and obviously the other question is recruitment. But as Theresa noted, there's several obstacles to recruitment, and one is that our immigration system isn't terribly flexible for individuals who might already be here. You have to still, if they already have foreign credentials, they have to be able to have their credentials recognized, and that can be a lengthy process. And unfortunately, right now, we're racing against time, and time is a luxury.
Yeah, I will say that there's been some efforts in the United States. New York Governor Andrew Cuomo apparently has reached out and tried to find a way to fast-track New York State licensure for foreign medical graduates in New York State. As Cris said, looking at the already resident population there who may be working in other occupations and not in the healthcare field, at least to come in and assist the medical staff, in some capacity. So I think that as the situation unfolds, as the medical and healthcare system in the United States gets stressed and stretched, all options are on the table, including maybe seeing if Congress is willing to either temporarily increase the availability of visas, temporary or permanent visas for foreign graduates, eliminate the 2-year residence requirement for JA students so they can be sponsored right away. There are a lot of options that might be able to be put on the table to try to address this, at least as an interim emergency measure.
All right, when we come back, the recession and immigrants. We're back. Most economists believe that the United States is now in a recession as a result of the economic impacts surrounding coronavirus, as companies and businesses shut their doors and millions of workers are being laid off. During the last recession, economic contraction threatened immigrant-heavy industries from IT to agriculture. But with such different reasons for this recession, will this time around be any different? Theresa, what are some of the immigrant-heavy industries likely to be impacted by a prolonged recession?
So I think immigrant-heavy industries tend to be consolidated at the lower end of the skills of the wage and skills spectrum, at the higher end of the wage and skill spectrum. So immigrants tend to be overrepresented in high-end skill sectors like STEM jobs, like we just talked about, healthcare professionals, IT professionals, a lot of the STEM scientific and research, but they're also heavily overrepresented in lower wage, lower skill occupations, such as frontline service workers and house cleaners, janitors, lower wage healthcare jobs like home healthcare aides and assistants. And in a recession, those jobs are the ones that you can't do remotely. So some of the higher end IT folks may still be able to stay employed if they can do their jobs remotely. There are certain visa strictures that are applicable there we can talk about in a minute. But an awful lot of the lesser skilled, lower wage immigrants who are in a lot of these industries, construction, like I said, home healthcare aides, retail service providers, grocery store clerks, for example, they don't have the ability to work remotely, and so they are either continuing to work if they're considered essential industries, or a lot of them are being laid off. And for immigrants that are not here legally, they are unable to access unemployment benefits. So they have no ability to support themselves or their families if that happens. For those who are here legally, again, they may be able to access some of these supports for a near term, but the longer the recession goes, just like lesser skilled and lower wage Americans, they will be struggling hard to try to continue to support themselves in the economy. And so I think that going forward, figuring out how we can help everybody get back to work as soon as possible on all of these jobs, once the coronavirus threat is minimized, is going to be the best help that we can give these folks.
Cris, what are some of the competing interests lawmakers face in addressing economic disruption in these immigrant-heavy industries?
I mean, the principal one is going to be balancing the need to ensure that native-born workers can find a job and be able to find employment, as the recovery begins and continues, against obviously ensuring that non-citizens, particularly in the industries that Theresa highlighted, are also able to return to work. I think that this is going to be a little bit tricky, right? Because whenever you see large-scale recessions, there is some elements of the public begin turning against the hiring of foreign-born workers, because obviously the sentiment is, why are you hiring foreign-born workers? They're Americans that are out of work. We need to get a job before they do. And so certainly that's one, it's important because obviously you want the entire American workforce to be able to return back to work. And that's something that's important. The challenge with that line of thinking, though, is that if certain industries are immigrant heavy, there is a level of training and skill and expertise, even in quote unquote low skilled ones like in agriculture. You just can't walk off the street and go pick strawberries. There's a level of experience, skill, knowledge, and training that you get on the job that would make it very hard for other individuals who aren't in that field or in that occupation, in that sector, to be able to do that. And then there's also the reality that just some Americans just simply don't want to work in certain industries, and that's primarily immigrants who want to work in them. Once again, the lower end of the skill spectrum. So, there is a sense of we need to help Americans first, but at the same time, there are certain industries where the only folks who are willing to work and who have the experience and the know-how are immigrants. And so that's sort of the trade-off, is that you want to make sure that both groups are able to return to work, but obviously you want to do it in a sense that gives, I think, everybody a sense that they're getting a fair shake in the recovery. And again, this isn't something that's easy. It's a very, very tricky dance to navigate. And I think that this is going to be one of those things where I think when you hear discussions of immigration coming up, that this is going to be, once again, a very tricky issue to navigate as we move forward. So that's a two-step that lawmakers need to keep in mind.
Yeah, so Theresa, how might lawmakers respond to some of these challenges that Cris mentioned at the state and federal levels, and what might be some smart ways to balance them?
So a couple things to bear in mind. I mean, while we are talking about immigrant-heavy industries, it's also worth reminding everybody that 3/4 of immigrants in the United States are here legally. There's a presumption that if you're in a lower wage or lesser skilled job, you're an undocumented immigrant, and that's just simply not true. And so we are talking about people who are naturalized citizens, green card holders, here legally in another status. These are people who have a stake in the United States, that believe, that are here and residing here, and they have an equal stake in the recovery as U.S. citizens do. So it would be wrong to presume, for policymakers or lawmakers to presume that helping immigrants is somehow hurting the country as a whole, and that these are people who have, I think, earned, for the most part, the right to participate in the recovery and are willing to support it. The other thing to bear in mind is that, there's a reason that immigrants are in these industries. As Cris mentioned, many of them are industries where Americans have chosen not to continue to work in large numbers. There's no industry that Americans aren't in, but there are definitely industries that fewer Americans are in. Whether or not the recession and unemployment will drive Americans into those industries, that's something that comes up very often. Well, if there are all these unemployed Americans, we should, why can't they go out in the fields and pick the strawberries? And the answer is, for most of them, if they have other means of supporting themselves, unemployment insurance and other things that they can get by on, they will choose to do that rather than take some of these jobs that are considered hard, they're not considered hard, they are hard jobs and frontline jobs. And these have been jobs that for a very long time immigrants have been the front line of. And so, it's I think unreasonable to expect that the entire economy is going to turn around and somehow immigrants will not be needed in some of these industries post-recession. There will be some realignment, that much is true, but we were already facing a demographic issue of a aging and declining workforce. That is not going to be changed by coronavirus. And so we do need to think, in the long term about how immigrants support our growth and the economy going forward, regardless of where we are in the short term. But I think the main thing to remember is that our immigration system, to the extent it can help, is very inflexible about being able to help. So as we mentioned, the system is has set caps, it has set categories of who is eligible, it has significant restrictions on the ability of certain non-immigrants, non-citizens to be able to come and work in the United States. And it hasn't changed since 1990. It is not flexible with regard to whatever economic needs the country might have at a given time. So one thing policymakers should consider is, one, how can our immigration system assist with the recovery? And again, I say assist because it's not going to be a solution, but it could be an assist. And what changes might we need to make to our immigration system to make it more useful in an economic recovery? I think those are the key questions that policymakers need to ask. How do we support the immigrants who are here, but also how can we use our system to assist in the recovery? And I think those are going to be key questions going forward.
Okay, after the break, why Congress didn't address immigration issues in the CARES Act. We're back finally today. Near the end of March, Congress overwhelmingly passed and President Trump signed into law a $2 trillion economic support package called the CARES Act. Despite rumors that some members of Congress were fighting for extending the status of DACA recipients for a year and other immigration-related provisions, the final bill ended up steering clear of pretty much anything having to do with immigration. But questions remain over whether non-citizens, especially undocumented immigrants, can and should access some of the supports offered to families. Before we get into the questions here, I want to welcome in Laura Hall, Managing Director at BPC Action, on Twitter at LHallDC. Welcome back, Laura.
Thank you. Happy to be here.
All right, Theresa, first question to you. Let's go back to those rumors. What seemed like it could be on the table in the negotiations, and why did those ideas end up getting left out of the final CARES Act?
So because Congress was considering such a large bill that really had a lot of momentum and seemed like it had to pass, there was a lot of wish list stuff that sort of got thrown into the mix at various points during the debate. A few of the items that we had heard about, one was related to agricultural workers and whether agricultural workers would continue to be allowed in, how to create ability for people to extend their status who might be expiring. There was provisions about whether or not additional H-2B temporary worker visas that had been granted by DHS should be withdrawn. There was some talk about whether there should be changes to the EB-5 immigrant investor program as a way of stimulating the economy to increase visas there. There were proposals for a permanent solution for DACA recipients to be added. And as you mentioned, none of those eventually made it into the final legislation. And I think some of it is because they were trying to tailor this to the needs of the stimulus. A lot of this stuff is sort of like I said, a long wish list of things that other people were thinking about and saw this as a vehicle to try to get something done. But the reality is that when something this big is happening, it's not always the best vehicle for getting those things done. And because they were trying to get it done under an expedited procedure, frankly, with not having to take a vote because not everybody could be there, these additional provisions were kind of a little too much for people to kind of get on board with to make sure everybody could be okay with to get it done.
Yeah, there's a big phenomenon in D.C. and legislation and things like that, kind of like the last train leaving the station is what they call it. When lawmakers get the sense that this might be one of their last chances to do a big bill before the Congress adjourns for the end of the year, everything tends to come out of the woodwork, and people want to add X provision or delete Y provision or things like that because they think this is their last chance to do it, this last train leaving the station. And I think we saw a little bit of that here in this stimulus bill. I think everyone realized both the gravity of the moment, that this was a very big, important bill that had to be passed. So, as Theresa mentioned, some wish list items kind of came out of the woodwork. But then at the same time, I think folks also realized the fragility of the moment, that this was a very finely crafted piece that had a lot of different components and things in it to deal with this very real crisis we're in right now, and adding things on it might kind of topple the whole thing. I don't know if folks know that like game Jenga, where you stack the blocks up higher and higher and higher, and then when you pull one, the whole thing comes crashing down. So I think some of those pieces that Theresa mentioned earlier that folks had thought about including were maybe going to be that Jenga block that brought down the whole thing. And I think lawmakers kind of backed away from some of those provisions.
Theresa, can non-citizens access any of the economic supports in the CARES Act? If so, which ones?
Sure. So the one piece that most people are talking about is sort of the direct checks back to taxpayers. And the provisions in the bill are pretty clear about that. First is, in order to get any of those direct rebates, you have to have filed a tax return in either 2018 or for 2018 or 2019. But secondly, and probably more importantly, you must have a Social Security number. So immediately, the Social Security number requirement leaves out any undocumented immigrants, even ones who may have been filing taxes under an ITIN or an individual tax identification number. It also makes clear that if anyone in the household has an ITIN. So, for example, if you have a U.S. citizen spouse who is married to an undocumented person and that they have an ITIN, but the citizen has a Social Security number, that entire household could be left out of the payments. Otherwise, legal immigrants, particularly green card holders, would be eligible as long as they had filed a tax return. Certain other legal non-immigrants, if they have resided in the United States sufficiently to be a tax resident and earn income in the United States, may also be eligible for some of these payments. With regard to some of the other benefits, things like small business loans or health care coverage, most of that is dependent on what the underlying rules are for those benefits regularly. So if an individual is eligible for them under Small Business Administration regulations or under Medicaid or Medicare regulations, they would be eligible. Again, most undocumented immigrants are not eligible for those things, and so they would not be covered under this bill.
Laura, might Congress extend some benefits to non-citizens in the future? And what made this point about non-citizen access so controversial?
I think it remains to be seen if they will extend it to non-citizens in the future. I think there's definitely a vocal group that's kind of pushing for that. I will go back to my earlier point, though, that these are often very carefully and delicately crafted pieces of legislation. And if there is something that a large majority of lawmakers think might kind of upset the apple cart and cause them to pull their support, that measure might get left on the sidelines. Another thing to think about in this matter, in this moment, we don't really know how logistically Congress might be voting on the next package. Both the House and the Senate have left Washington, D.C. House and Senate leadership have indicated at this moment there isn't really a desire to do remote voting. So while we're still kind of in this environment with difficult travel and difficult, methods to get back to D.C., this next package is going to be, it's up in the air how they might actually physically cast the votes on it. A mechanism that you saw the House do for this last stimulus bill was called unanimous consent, which means that they were kind of able to pass the bill because no one objected to it. There was kind of an attempt by one member to object that was able to be kind of pushed aside and dealt with by the rest of the Congress. So if they feel that unanimous consent might be the only way that they can get the next package through because they can't physically be in Washington, D.C., it's going to have to be something that they know gets the support of the majority of the members. And I'm not sure looping in non-citizens is a non-controversial decision. I think lots of folks would want to be on the record for that one way or the other. So my crystal ball looks a little hazy and unlikely on that one.
All right, that's a good place to leave it for today. Theresa, Cris, Laura, thanks so much for joining me. And thanks to you all for listening. We'll be back in 2 weeks. Before we go, a quick reminder to subscribe, rate, and review this podcast on Apple Podcasts, Google Play, Stitcher, Spotify, or your favorite podcast platform. You can also find more information on all the issues we discuss here on the show at bipartisanpolicy.org/immigration. This Week in Immigration was created by Theresa Cardinal Brown and myself. The executive producer of This Week in Immigration is Theresa Cardinal Brown. This week's episode was written by Cris Ramon and myself. Our producers are Cris Ramon and Yafet Tawahada, and our editor is Yafet Tawahada. The executive producer of BPC Podcasts is Ashley Swearingen. I'm Jordan LaPier. Join us again next time on This Week in Immigration.